Healthlink is proudly brought to you by Moods Condom and Home Fresh.
Hello and welcome to Healthlink TV show with me, Stella. Today on the show, we'll be discussing abortion or miscarriage. We'll be talking to a specialist who will help us understand the whys, the how and what about this unfortunate occurrence. This show is proudly sponsored by Moose Condoms and Home Fresh. Make this weekend memorable with Moose Condoms. It's available in all pharmacy shops. Moose Condoms, play it right. Let's go for a break. When we come back, we start our discussion on abortion.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Hey. Flowers on the bed. Hey. Plain Kojo Inchi. Wow. Honestly, I was still too tired. But then he pulled it out. Moods Condoms. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms. This comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms. Play it right. Marketed and distributed by Pharma Nova Limited.
Miscarriage is a natural process and happens when a baby hasn't formed completely. Unfortunately, the miscarriage process can't be reversed once it has started. Miscarriages can happen for a variety of medical reasons, many of which aren't within a person's control. But knowing the risk factors, signs and causes can help you to better understand the event and get any support or treatment you may need.
Thanks for staying with me. To our understanding, abortion is the loss of pregnancy. But today we have with us a specialist from B&G Medical Center. He's in the person of Dr. Benedict Afari. He's here to throw more light on abortion. Doctor, you are welcome. Doctor, what is abortion?
So abortion is the end or termination of a pregnancy.
Okay.
Either by removal or expulsion of an embryo or a fetus.
Okay.
Before the age of viability.
Okay.
And in Ghana, our age of viability is 28 weeks.
Right.
So any pregnancy that comes out before 28 weeks is classified as an abortion. Or you cannot say that it's an abortus if you want to just give a noun to what is coming out. And for the abortion, we have two main types. We have the spontaneous abortion and the induced abortion.
Okay.
And the spontaneous abortion is usually also called miscarriage because most people are not comfortable with the word abortion.
Okay.
So in a sense, anytime you talk about abortion, it's more like signifies the induced abortion.
Okay.
Yes.
Doctor, what is expulsion? Because you said earlier it can be exposed or something like
that. So I said it could be a removal or expulsion of the embryo or fetus.
Okay.
Yeah, so the word removal means probably there's an intervention. Expulsion more like is spontaneous.
Okay.
What it means is that there's no intervention.
Okay.
So that's what we're using now because the abortion is, you have two types. So you need to, when you are defining it, you bring both the spontaneous and the induced in the definition. So that's why I mentioned removal or expulsion. of an embryo or a fetus. Yes.
And what is the difference between the two types of abortion?
Okay, so with the spontaneous abortion, that means there's no intervention. It comes out by itself due to certain factors that we'll talk about going forward.
Okay.
Then with the induced, that means there's an intervention.
Okay.
Either we are using the medical means or we are using surgical means to remove the fetus.
Okay.
So that's the difference between the two.
Okay. Then for the sake of our time, let's focus more on the spontaneous abortion.
Okay, no problem.
What is spontaneous abortion?
So, with a spontaneous abortion, there's no intervention.
Okay.
So, due to certain factors, the pregnancy comes out on its own.
Okay.
And it could come out, as I said, before the age of viability.
Okay.
But we've gone further to try and reclassify so that we're able to put in some intervention. So we could have an early spontaneous abortion, in that one occurs usually within the first 3 months.
Okay.
Then we can have a late one after 3 months up to the age of viability.
Okay.
So you could have that. And even sometimes we have what we call the delayed type of abortion. That means you lose the pregnancy, but it doesn't come out.
Wow.
Yes, so that's what we mean by the missed abortion.
What causes missed abortion?
So the causes of missed abortion are numerous. Usually with the causes, we tend to use what we call the risk factors.
All right.
Yes, so we have the risk factors and we have what we call the causes. So the risk factors are usually certain factors that either due to the mother or the baby, it's not going to engender the baby to stay in the womb, so it has to come out.
Okay.
Yes, so that's what it means.
Doctor, I want you to explain the kind of women at risk of getting abortion or miscarriage.
Okay, so with a spontaneous abortion, we have a lot of risk factors. So one of the main risk factors are what we call the advanced maternal age.
Right.
Usually we say that in order to prevent some of these spontaneous abortion, we recommend that women give birth early.
Okay.
So the age we normally refer to is 35 years. So any woman giving birth at 35 years or more, there's an increased risk of having a spontaneous abortion.
And what causes this?
Yes, because with increasing maternal age, you tend to have what we call a lot of these chromosomal abnormalities. Yes, then the other aspect is that when a woman is growing, there is the quality of the eggs declines.
Okay.
So you realize that the egg that the sperm is going to fertilize is not as good as somebody who is younger.
Wow.
So even that can predispose you to having a miscarriage.
Okay.
Then other factors such as alcohol,
Okay.
if a woman drinks alcohol,
Okay.
if a woman smokes,
Okay.
all these can also predispose you to having a spontaneous abortion.
Okay.
Then sometimes if you've had an episode in the past,
Okay.
it increases your chances of having a spontaneous abortion. Then other factors such as genetic factors. So like I mentioned, usually that one is linked with the age. With increasing age, you tend to have a lot of these chromosomal abnormalities. The common ones, we have the trisomies, we have the Down syndrome and the like.
Okay.
Then we also have other endocrine conditions that predispose women for getting spontaneous abortion. For example, if you have diabetes and it's uncontrolled, if you have a thyroid disease, or even some of the women, they have this condition we call the polycystic ovarian syndrome. And that is also an endocrine disease because you tend to have a lot of insulin resistance, leading to very high levels of insulin in the blood that could trigger the abortion. Then for some people too, they have some other factors, factors with the uterus itself or the womb.
Okay.
Then there are people who also have some immune factors.
Okay.
Yeah, so there are a lot of factors that could lead to spontaneous abortion. And let me also add that even infections can cause spontaneous abortion. Infections in the genital tract, like if you have vaginitis, you have bacterial vaginosis, all these can also predispose you to having a spontaneous abortion.
Well, early on, you said advanced age can cause abortion.
Yes.
Does it mean that young age people can't get abortion?
No, what I said was that it's a risk factor.
It's a risk.
Yes, a risk factor. So it does not necessarily mean that once you are advanced in age, you will get, but your chances are higher
Okay.
Exactly, your chances are high, especially for those we put into the category of recurrent miscarriage. You know, you can have just a spontaneous abortion, just one episode.
Okay.
Or you could have repeated episodes of spontaneous abortion.
Okay.
So usually if you have about 3 episodes of spontaneous abortion consecutively, like 3 times in a row, usually the early one, then we say that you have a recurrent abortion. Or sometimes we can use the term habitual abortion. Or sometimes you can lose like 2 pregnancies, late ones. That one we can classify it as recurrent abortion. So for those who have advanced maternal age, there's a risk because of what I already explained, the quality of the eggs and the fact that those people are prone to having a lot of these chromosomal abnormalities. So that's why those people are prone to having spontaneous or recurrent abortion. It doesn't mean that the young people will not get. They may get, but if you look at the mechanism or the pathophysiology, theirs is a bit different. But anybody can get spontaneous abortion.
Okay.
Yeah.
So what are the signs that you need to look out for in spontaneous abortion?
Okay. So usually the first sign or the symptom that can tell you that there's probably something wrong with the pregnancy, that you could bleed. So bleeding is usually the first sign. For some people, they may be having a persistent lower abdominal pain.
Okay.
Then for some people to realize that the pregnancy symptoms, there's a regression. For example, you know when you get pregnant, you start having nausea, vomiting, dizziness, but you realize after a while, you tend to lose some of those symptoms.
Okay.
So usually for those who have that, it is the mixed abortion type, like I talked about before. Those people, they have the regression of the pregnancy symptoms because like the fetus is not growing anymore. So all those symptoms kind of subside.
Right.
Yes, yes. So those are some of the symptoms.
Okay. Let's go for a quick break. When we come back, we'll continue our conversation on spontaneous abortion.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Flowers on the bed. Clean Cujo Inchi. Honestly, I was still too tired. But then he pulled it out. Moods condoms. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms, layered right. Marketed and distributed by Pharma Nova Limited.
Welcome back. This program is proudly sponsored by Moose Condoms. If you are playing, play it right with Moose. And with Moose, you always play it right. It comes with over 19 exciting variants. Moose condoms are available in all pharmacies. Doctor, you were talking about bleeding during pregnancy. And I've heard a lot of women complaining that they mostly bleed during their pregnancy, yet they still take the pregnancy to term. So what's the cause of that? Is that one too a sign of abortion?
Okay. So if you look at the types of miscarriages or spontaneous abortion, we have types. So we have what we call a threatened abortion or threatened miscarriage. What it means is that you may bleed, but the pregnancy could still go on to term.
Okay.
There are people who also say that, oh, they bleed throughout the pregnancy, but it still goes so. So sometimes they may be having some medical condition that can cause that. Then there are times that people can also have what we call the implantational bleed.
Okay.
So that's the initial phase of the pregnancy.
Okay.
But usually any bleeding in pregnancy is not a good sign.
Okay.
So you need to go to the hospital for them to investigate, to know whether it's a good, what is going on, then you can be treated or taken care of.
And what are some of the complications of spontaneous abortion? In case someone experience spontaneous abortion, are there any complications afterwards?
Yes. So with spontaneous abortion, once the pregnancy comes out, you could have severe bleeding or hemorrhage because you could bleed and it can affect your hemodynamic state. Then the other aspect is that you could actually get an infection if the product of conception doesn't come out or doesn't come out and it stays in the system. You can have an infection. Then you could also have a bleeding disorder. If, for example, the product of conception, you are not aware, it stays in the system for a very long time, it could enter into the bloodstream and cause a coagulopathy. What it means is that it could cause a bleeding disorder. Yes, then apart from these medical complications, you could also have the emotional and the social aspect of you having a spontaneous abortion. Then the fact that, I mean, it could also lead to an infertility, because if you keep on having spontaneous abortion, that means you are not going to have a child. So people may now tag you as somebody who is barren or who is infertile, even though you've been getting pregnant, but you are unable to take the pregnancy to term.
In case someone reports your facility with spontaneous abortion, how do you manage these clients or patients?
So the management of spontaneous abortion, you follow a certain order. So you need to take a good history, a detailed history. Then when you take the history, you're looking at all the risk factors that we've already discussed. Then after that, you need to examine the patient. Then after that, you conduct some tests. Then when you finish, then depending on what you find, then the treatment comes in. So the management encompasses all what I've talked about. So once you take the history, you'll be able to know what happened. Were there any risk factors? Were there any infections? Or the woman took some medications, maybe over-the-counter drugs or herbal medication. So you need to take a very good history. Is it a previous history of a spontaneous abortion? And when did it occur? Was it within the first 3 months or after the first 3 months or not? Because we have different interventions depending on when it occurred. Then when you examine, we are looking at the abdomen, looking for the uterus or the womb. And that one, you want to know the size of the womb. That one will translate to how many weeks the pregnancy is. Then normally for gynecologists, you need to do what we call a speculum examination. Yeah, so there's an instrument that we use. We have the plastic type, we have the metallic type. So that one, what you do is to help you to visualize the vagina and the cervix. When you pass the speculum, you'll be able to see what is happening to the cervix, whether it's opened or not. And it will also help you to be able to know whether there's any bleeding, then there's any infection or any other thing that you could see. Then after that, so after your history, your examination, then you may want to do an investigation. And most of the time, the investigation that we do is to do a scan. Yeah, so after the scan, then you can conclude as in whether it's a threatened abortion or miscarriage, whether it's a complete miscarriage or whether it's an incomplete miscarriage, or even whether it is a missed abortion or a missed miscarriage, or even what we call the inevitable abortion or miscarriage. So the history examination will be able to tell you these types of miscarriage, and once you know the type, then you could manage it accordingly.
So apart from the hospital management, what kind of support do people who have experienced spontaneous abortion need from family and friends? Is there any therapy that they need to go through?
Yeah, you know, spontaneous abortion, or those who tend to have the recurrent miscarriages, is a very stressful and a distressing situation for the women. So, I mean, they need a lot of psychological support, a lot of emotional support from the family, from the spouses, and even the health workers as well. Because it's not easy for you to try to achieve a pregnancy and you lose it. You know, in this part of the world, we place a lot of premium on having children. So if you keep on losing your babies, if I should put it that way, then it's not an easy task. Of course. Yeah. So apart from the medical bits that we do in the hospital, making sure they are well taken care of, the other aspect, the spouses come in, the relatives, the extended family, everybody comes in just to support the woman, for the woman to know that she's not in this situation alone. and that also help her to be able to move on in life.
Per your definition, you said it occurs on its own, spontaneous
Exactly.
abortion occurs on its own. But can you prevent spontaneous abortion from occurring?
Yes, so some, the spontaneous abortion, we've already looked at the causes and the risk factors. There are a lot of them. So some of them, even though a bit controversial, but some of them, we tend to do certain things to be able to try and prevent or minimize them. For example, those that are caused by, let's say, the endocrine or hormonal problems, we try to stabilize the woman or treat them. For example, if you have diabetes, we need to control it. Then it will minimize your chance of having a spontaneous abortion. If you have a thyroid disease, we can treat it for you. If you have the polycystic ovarian syndrome that I talked about, it can be treated. So if you can identify some of these causes, once you treat it, you can minimize it. Then even the other thing I didn't even add, there's this group of risk factor or cause of spontaneous abortion that we call the autoimmune. So sometimes you have the body producing some antibodies against itself, so that can cause a miscarriage.
And can that one be prevented? So
we have ways of managing it. For example, one of the commonest type of this autoimmune is what we call the antiphospholipid syndrome.
Wow, that's quite
It's a very big word, yes. So that one is an autoimmune condition. So that one, for example, what we do is that studies have shown that if you give them certain medications, it can minimize their chances of having a spontaneous abortion if it is caused by that autoimmune condition. Yes.
And how soon can someone who has experienced spontaneous abortion have sex or try to get pregnant again?
Okay, there's no hard and fast rule about it. Usually what we advise the women to do is for them to wait for the menses to come back. So once your menses resume, we know that the system is back on track. Some people, sometimes we tell them to avoid achieving pregnancy for about 3 months. And the rationale behind that is for us to be sure that all the issues that cause the pregnancy have been resolved. So that when you undertake another pregnancy, you wouldn't have a recurrence of that spontaneous abortion. So sometimes we advise them to try and wait for a while before.
About how long?
Yes, so usually if you are a young person, you could wait for about 3 months to 6 months. But for those who are already advanced in age, we already talked about advancing maternal age causing a lot of this spontaneous. For those who they can't really wait, so usually after the menses has resumed, sometimes for some people the menses can resume within a month, others maybe 6 weeks or 2 months. But usually by 3 months your menses should be back. Then once you've resumed the menses, you could start again. But the other thing I want to add is that usually if you've had any spontaneous abortion, that means your next pregnancy, you need to visit the hospital. So in some parts of the world, or even something that we are encouraging now, is what we call the preconception care. So with the preconception care, it looks at some of these problems. If you had spontaneous abortion in the past, we need to look at what happened. So if you have some medical conditions, we need to manage it before you even embark on another pregnancy. Or if there's any infection, you treat. Or if there's any problem that we found that could have resulted in the spontaneous abortion, we need to resolve all those issues before you embark on another pregnancy to reduce your chances of not getting another spontaneous abortion.
Doc, you've taken the words out of my mouth. But before we go, what can you tell our mothers, the young people out there, and those in advanced age trying to get pregnant?
Okay, so in summary, I want to say that anybody could get a spontaneous abortion. If you actually look at the numbers, about 15 to 20% of all pregnancies may end in a spontaneous abortion. So it could affect anybody. But once you've had a spontaneous abortion, it behoves on you to go to the hospital for your doctors to take the necessary history, examine you, and do the necessary investigation so that it will help to be able to prevent another spontaneous abortion. if
Okay.
possible. So they shouldn't sit down and listen to people and all the misconceptions that they will give them, but they should go to the hospital and they will be sorted out. So that's what I would say.
Doctor, thank you so much for educating us on spontaneous abortion. We hope to see you again so that you can educate us on the other type of abortion.
Yes, you are welcome.
Viewers, thank you so much for watching Healthlink TV show. Join me next time as we talk about the other type of abortion. This show was brought to you by Moose Condoms and Home Fresh Foods. This has been your favorite health program, Healthlink TV show. Everything on health.
Healthlink was brought to you by Moods Condom and Home Fresh.